We came winter time. The weather, we are not used to winter. We don't have winter in Africa. In 1991, our country, the government was overthrown and a civil war erupted. So a big portion of the population moved to neighboring countries. For me, I moved from Somalia to Kenya, but I didn't stay long in Kenya. I moved to Uganda. So in Uganda we stayed as refugees. We were registered there till 2012 when we got our resettlement to the United States. So in 2012 October, we were brought here with a family of 9, with the 2 parents and 7 kids. We came to Bowling Green through the International Center. It is the International Center that gave us a lot of assistance. We do not know about Medicaid or anything like that, because in Africa we don't have it.
I think one of the biggest challenges as far as addressing those issues is finding a provider who is willing to work with our clients to make sure that that condition is under control. I know whenever they do the health assessment, when they go for the second part, that's when they meet with the doctor and they go over all of that, and they'll give them prescriptions to help them maintain it until they can get into a primary care doctor. So that kind of helps with the beginning part of it. But once it comes time for the primary doctor, we only have a few very few in Bowling Green that will work with our clients. And so that's a challenge for us, is trying to get them to somebody who we know will take care of them and provide them with the service that we would receive,
Health care insurance coverage does not often cover some of the conditions that need to be addressed. So some of what the refugees experience is no different from what the regular or normal American resident or citizen has to go through.
We provide transportation as much as we can. We use a taxi service, and it's always not the most reliable. And we always find out days afterwards that the client did not attend, or the reason they didn't attend is because the taxi did not come and get them.
We've seen it, the providers are faced with challenges in different categories, but one of them is language barrier, because most of these refugees are coming from countries where English is not spoken as the first language, or even second language, or not spoken at all. So in that way, communication, when it comes to issues like healthcare, we have to find a way of facilitating the communications. And providers, if they don't get the right information or full information from the patient, then the process of care itself will be compromised.
One of the major issues is cultural understanding, cultural awareness, cultural competency, and cultural humility. Where we have a more open-minded approach to learning about the new cultures that are coming, as well as we are, the same way that we're expecting them to assimilate and to integrate and to start living the way we live here in America, we also need to learn.
intaan xanuunsan ka hor macnaha caafimaadkayga wuu fiicnaa macnaha.
He has been working at Trustlaker for several years, but last year April, that is when he fell ill, and he was admitted here in the medical center. That time he had this health insurance from Trustlaker. That couldn't cover anything because it pays a smaller percentage. So, you see, when he was in the hospital, they have people there at the hospital who do apply for you Medicaid. He got Medicaid while he was still in the hospital. Since then, he has been using that.
And it has helped him a lot because he doesn't work now. Since he got to that heart problem, it is now 1.5 years he doesn't work. But he says the city has been good for him.